Good morning, everyone. My name is Jeong-Byoung Chae. I'm a PhD candidate in Seoul National University in Korea. It is a great honor to show my research result and also discuss with many professionals. My topic is comparison of causative agents of bovine diarrhea and acute spike proteins between healthy and diarrheic Korean indigenous calves, which is also called HANU. My presentation will be showed like this. Calf diarrhea is one of the biggest health challenges and economic losses in bovine industries. Calf diarrhea are occurred by many factors: infectious agents, environmental factors, and management problems. There are many reports about calf diarrhea in Korea. In large diarrhea farm, calf deaths. 50% of calf deaths was caused by calf diarrhea, and in beef farm, more percent of calf deaths was caused by calf diarrhea. In the presentation in 2016 in Korea, infectious agents were detected in 950 with diarrheic feces, which was more than 80%. And more than 15 infectious agents were reported in Korea, including Eimeria species, rotavirus, coronavirus, and bovine viral diarrhea virus. However, most of reports in Korea were focused on infectious causes. Of course, it is really important to know which agents are causing calf diarrhea, but not only infectious agents, but measuring conditions of each calf should be considered for the treatment. Recently, there was no report about focusing on measuring calf status in calf diarrhea in Korea, so we thought a correct method for calf health status needed to be developed. Acute phase response is a complex systemic early defense system of reactions activated by many factors, including inflammation. In APR, synthesis of some proteins, which are known as acute phase proteins, were changed. There are many kinds of acute proteins. Among them, haptoglobin and serum amyloid and fibrinogen were known as prognostic indicators in bovine species. However, acute phase protein changes were controversial in calf diarrhea, so our research was to identify the causative agent of calf diarrhea from Korean indigenous calf and their relationship between causative agent, calf diarrhea, and their effects on APPs. So we selected some farms and blood and feces were collected. From that samples, we detected some infectious agent and also evaluating some APPs. In briefly, 10 local Korean indigenous cattle farms were selected in 2016 and 2017, and calves aged up to 60 days were selected to collect blood and feces, and the samples were transported to laboratory for further research. We scored our feces sample as 0 to 3, and our scoring system was based on University of Wisconsin Calf Health scoring system, and we considered score 0 and 1 feces as normal feces, and 2 and 3 feces as direct feces. And we tried to detect infectious agent. 2 methods were performed: real-time PCR and flotation method. By real-time PCR, E. coli K99, cryptosporidium species, Salmonella species, bovine rotavirus group A, bovine coronavirus, and bovine viral diarrhea virus were detected, and for the detection of Eimeria species, flotation method was performed. 30% of fecal homodogen in PBS were prepared, and nucleic acid preparation and real-time PCR were performed by commercially available kits, and all steps, including primer and probe, were followed by previous reports. For Eimeria detection, flotation was performed, briefly, Schiller's sugar flotation procedure, and microscopic examination was performed. Also, all procedures were followed by previous reports. To evaluate some APPs, commercially available sandwich ELISA kits were used to evaluate haptoglobin and serum amyloid, and fibrinogen concentration were calculated by the differences between serum protein levels and plasma protein levels. For the evaluation of each protein levels, handheld refractometer was used. So we collected 544 feces, which were composed of 340 normal feces and 204 direct feces. As you can see, most of age groups showed similar percent of diarrhea. The direct samples were shown by green bar. Spring was the season when direct samples and also samples were most collected, but summer was the season when diarrhea was the most commonly detected. We could not collect samples in the winter season because most of farms in Korea are doing seasonal reproduction, so there is not enough samples. And also, we could not find any significant factors of diarrhea differences between farms. By real-time PCR, among 6 pathogens, we found 5 pathogens, and 24 Cryptosporidium species, 1 E. coli K99, 46 coronavirus, and 4 BBDB, and 48 rotavirus were detected. By flotation method, 149 Eimeria species were detected. So we analyzed our samples by sample status and also age group, and we found that in Cryptosporidium species infection, normal and diarrhea group showed differences, significant differences. However, we found only 1 E. coli K99 in diarrhea group. We also find coronavirus in normal and diarrhea group, but there was no significance, and we only found 4 DBDB in normal group. In rotavirus infection, we found significant differences between in normal group and diarrhea group, and we did not find any significance between normal and diarrhea group in Eimeria species, but we found that Eimeria species were related to age group. As you can see, 1 to 10 age and other older age group were significantly different, sorry. To evaluate APPs, we found all of APPs were higher in diarrhea group, but only haptoglobin and fibrinogen were significantly higher in diarrhea group. And also, we did not find any significance in the number of infectious pathogens in APPs, but in the infection of each pathogen, some of pathogens showed significantly differences in SAA, not in haptoglobin and fibrinogen. However, the concentration of SAA in normal group feces were higher than those in diarrheic feces group in bovine coronavirus and Eimeria infection. So as SAA concentration was not what we had expected, we was focused on SAA concentration, and there was a report that the concentration of APPs were getting decreased while calves were getting older. So, and similar pattern was found in SAA in our research. In our research, SAA was getting decreased if calves were in high age group. So we thought SAA might be more affected by age than diarrhea status or infection of pathogens. In conclusion, we analyzed 544 calves were analyzed, and Cryptosporidium species. Among 7 pathogens, 6 pathogens were detected, and the infection of bovine rotavirus and Cryptosporidium species were detected more in diarrhea group. The concentration of haptoglobin and fibrinogen showed significantly higher in diarrhea group than in normal group, but the concentration of SAA showed higher in diarrhea group than in normal group, but not significantly. However, concentration of SAA showed the relationship between calf age. So we thought APPs might be related to diarrhea status, but not with infectious agent. Nowadays, I'm trying to my research focus on three topics: development of vaccines for diarrheic pathogens, and also dynamics of APPs in challenge models. And if we can get some more fecal blood samples, that we can set our APP criteria settings. I'd like to say thank you to my supervisor, Professor Junseok Chae, and also organizer of this research, Jin-Ho Park. Here's the reference, and thank you for your listening.